Your cat is hiding something from you right now. Something serious. Something that could be stealing years from their life while you assume everything's fine. Most cat owners miss the warning signs until it's too late. Not because they don't care, but because cats are masters at masking pain. This silent threat affects millions of cats, yet 95% of owners have no idea their pet is suffering. What you're about to discover could save your cat's life. Let's count down the 10 signs you can't afford to ignore. But before we get started, be sure to subscribe to our channel and ring the bell to get notified about our latest videos. Number 10. Subtle litter changes. Your cat's litter box tells a story most owners never read. When a cat suddenly prefers the edge of the box instead of the center, or starts going just outside it, they're communicating distress. This isn't defiance, it's often early kidney disease or urinary issues causing discomfort. Many owners blame the cat or the litter brand, missing the medical emergency unfolding. Watch for increased frequency, straining, or unusually small clumps. These changes can appear months before other symptoms surface. Kidney disease is one of the leading killers of cats over 7, yet it progresses silently. By the time most owners notice something's wrong, 75% of kidney function may already be lost. Your cat isn't being difficult. They're asking for help in the only way they can. Number 9. The weight mystery. That slow, gradual weight loss you've been attributing to age? It could be the first domino falling. Cats are experts at hiding illness, and by the time weight loss becomes obvious, the underlying condition may be advanced. Hyperthyroidism, diabetes, and cancer all cause weight loss while appetite remains normal or even increases. Many owners actually feel relieved when their older cat loses a little weight, thinking it's healthier. But healthy weight loss doesn't happen in cats without deliberate dietary changes. Even losing just half a pound matters in a 10-pound cat. That's 5% of their body weight. Imagine losing 5% of yours without trying. Track your cat's weight monthly, especially after age 7. Early detection transforms outcomes, but most cats aren't diagnosed until symptoms become severe. Number 8. Drinking water differently. When your cat suddenly becomes a water fountain enthusiast, your first thought probably isn't medical emergency. Most owners find it charming or assume their cat is just staying hydrated. But increased thirst is one of the earliest signs of kidney disease, diabetes, and hyperthyroidism. Conditions that kill thousands of cats annually. Cats are desert animals by evolution. They're designed to get moisture from prey and drink minimally. A healthy cat drinking noticeably more should raise immediate concern. This symptom often appears alongside increased urination, but because cats are private about bathroom habits, owners miss the connection. By the time excessive thirst becomes obvious, these diseases have often been progressing for months. Your cat isn't just thirsty, their body is desperately trying to compensate for failing organs. Number 7. Grooming gone wrong. Your once pristine cat now has a greasy coat or matted fur. You assume they're getting lazy with age, but cats don't stop grooming out of laziness. They stop because something hurts. Dental disease, arthritis, and kidney problems all make grooming painful or exhausting. A cat in chronic pain won't maintain their coat the way a healthy cat does. This is especially true for older cats whose mouths may be filled with infected teeth, causing constant agony. Many owners don't realize their cat has severe dental disease until a routine vet visit reveals it. Meanwhile, the cat has been suffering silently for months or years. A dull, unkempt coat isn't a cosmetic issue. It's a red flag that your cat's quality of life has deteriorated. When cats stop caring for themselves, they're telling you they need help. Number 6. Appetite shifts. Your cat used to demolish every meal. Now they're picking at food, walking away from their bowl, or only eating treats. Most owners try switching foods, assuming their cat is just being picky, but healthy cats don't suddenly become picky eaters. Decreased appetite is often the first visible sign of kidney disease, liver problems, or gastrointestinal issues. Cats can develop life-threatening conditions within just a few days of not eating properly, a problem called hepatic lipidosis. Their bodies aren't designed to go without food. What looks like choosiness is often nausea, mouth pain, or metabolic dysfunction. Even a cat who still eats but consumes less than usual is cause for concern. Don't wait until your cat stops eating entirely. By then, you're facing an emergency that could have been prevented with earlier intervention. Number 5. Hiding. More often. Cats seek solitude when they're sick or dying. It's instinct from their wild ancestors. If your normally social cat suddenly spends hours under the bed or in closets, they're not just seeking peace and quiet. They're likely experiencing pain, nausea, or weakness they're trying to hide from potential predators, which, in their instinct-driven mind, includes you. This behavior often accompanies other subtle symptoms owners dismiss. By the time hiding becomes constant, the cat may be in crisis. Many owners only realize something was seriously wrong when they find their cat unresponsive in a hiding spot. Cats don't hide because they're antisocial. They hide because they're vulnerable. Increased hiding should trigger an immediate vet visit, especially in senior cats. Number 4. Breathing differently. You notice your cat's breathing seems faster than usual, or they're breathing through their mouth after minimal activity. Most owners chalk this up to stress or heat, but cats don't pant like dogs. If they're breathing abnormally, it's a medical emergency. Heart disease is incredibly common in cats and often goes completely undetected until they're in heart failure. Difficulty breathing can also signal asthma, fluid in the lungs, or anemia. These conditions deteriorate rapidly. A cat breathing normally one day can be in respiratory distress the next. The challenge is that cats hide breathing problems until they're severe. By the time you notice, they may have been struggling for weeks. Respiratory issues in cats require immediate veterinary attention. Not tomorrow, not next week. This is one sign you can't wait on. Number 3. Energy level decline. Your cat sleeps more, plays less, and seems content to just exist. You assume it's normal aging, but cats don't just slow down the way dogs do. When a cat becomes lethargic, there's usually an underlying medical cause: anemia, heart disease, pain from arthritis, or metabolic disorders. The insidious part is how gradual these changes are. Over months or years, you adjust to a new normal without realizing your cat's quality of life has plummeted. Many cats suffering from chronic conditions still purr, still eat, and still seem fine to owners who don't know what to look for. But fine isn't the same as healthy. A cat who stops greeting you at the door, no longer jumps to their favorite perch, or ignores toys they once loved is telling you something's wrong. Don't dismiss these changes as inevitable aging. Number 2. Vomiting regularly. Hairballs happen, right? An occasional vomit is normal? Actually, no. While many cat owners accept frequent vomiting as just part of having a cat, it's not normal and often indicates serious problems. Inflammatory bowel disease, food allergies, kidney disease, hyperthyroidism, and even cancer can all cause chronic vomiting. When owners mention their cat vomits a few times a week, vets are alarmed, but owners have normalized it. Chronic vomiting damages the esophagus, causes dehydration, and is a sign your cat's body is in distress. Some cats vomit for years before owners seek help, by which time the underlying disease is advanced. If your cat vomits more than once a month, that's too often. Track the frequency, note what comes up, and get veterinary advice. What you've accepted as normal could be the warning sign that saves your cat's life. Number 1. Subtle behavior changes. This is the sign that encompasses everything else, the one thing almost every owner misses. Your cat is slightly off. They're not dramatically sick, just different. Maybe they're a bit quieter, slightly less affectionate, or they've changed where they sleep. These tiny behavioral shifts are how cats communicate illness before it becomes obvious. Because changes happen gradually and cats are already mysterious creatures, owners dismiss these subtle cues. But cats are creatures of habit. When those habits change, there's a reason. This is especially critical because it's often the earliest sign of all. The cat who stops sitting on your lap might have arthritis pain. The one who stops meowing might have dental disease. Subtle isn't insignificant. These quiet changes are your earliest warning system, and catching problems at this stage can mean the difference between simple treatment and managing a chronic, life-threatening condition. Your cat depends on you to notice what they can't tell you. These 10 signs aren't just symptoms, they're your cat's silent plea for help. The earlier you catch these warnings, the better the outcome and the longer you'll have together. Kidney disease, heart problems, diabetes, cancer, they're all treatable when caught early. Don't wait for a crisis. If you noticed your cat showing even one of these signs, schedule a vet visit this week. Which sign surprised you most? Drop a comment below, and if this video might help another cat owner, hit that like button and subscribe for more life-saving pet health content. Your awareness could save a life.